Hi, I'm Jessica Gomez, in for Soledad O'Brien. The battle lines are drawn. Republicans vowing to repeal and replace Obamacare are taking their first steps. In the coming week, the Senate is expected to pass a budget resolution that could begin the dismantling of Obama's signature law. The Republican majority says most Americans want Obamacare to go. In fact, according to a recent poll, Americans are divided. 29% say the Affordable Care Act has hurt them and their families. 18% say the ACA has helped them. 51% say it has had no impact at all. And Democrats gearing up for a long and potentially nasty fight say repealing the plan will create chaos. So if Obamacare is repealed, what will go in its place? And what does that mean for those millions of people who are currently covered? Senator Bill Cassidy, a Republican from Louisiana and a physician for 3 decades, joins us now to talk about what's next. Senator Cassidy, thanks so much for joining us. We appreciate it.
Jess, thank you for having me.
As a physician yourself for years, you've sponsored your own replacement health care legislation. What, in your opinion, is working with the Affordable Care Act and what's not?
Well, clearly the fact that people with pre-existing conditions don't lose their insurance is a good thing. The fact that kids can stay on their parents' insurance till age 26, originally a Republican proposal, by the way, is a good thing. On the other hand, the cost is exploding. A friend of mine, he and his wife, 60, 61, their policy was they just got the piece, I put it on my Facebook page, $39,000 a year, each with $6,000 deductibles. Whenever you hear Obamacare referred to as the Affordable Care Act, you want to start to laugh. It's not affordable. It's unaffordable.
President-elect Trump seems to support some of the Affordable Care Act, as you mentioned, not discriminating against people with pre-existing conditions, keeping young people on their parents' plans. What do you envision, if you had it your way, what would stay and what would go?
From my perspective, Washington, D.C. should give this to states and to patients. The proposal we put forward would allow state legislatures to either go with the alternative that Republicans will give, an alternative that gives the patient the power, not a Washington bureaucrat. But if a state decides to stay in Obamacare, the state could decide to stay in Obamacare. So if California and New York want to stay on Obamacare, they would now control it from Sacramento and Albany. Or if a state really wants nothing, the state could entirely repeal Obamacare within their borders and not replace it with anything. I, again, think that the person who governs closest governs best.
Republicans say they want to make this a smooth transition. How is that going to be possible in your mind? How do you envision that happening? And will people who are currently insured right now lose their insurance?
First answer, working backwards, no. The people who are currently insured now will keep their insurance. The woman with the breast lump, if she's the prism through which we will look at things, she needs to be able to continue through her management, chemotherapy, and recovery. The proposal I put forward, though, and Susan Collins is a co-sponsor, a similar proposal with Pete Sessions, Congressman Sessions, that has been introduced in both chambers. We would, in this year, 2017, pass the repeal, replace legislation. In 2018, state legislatures would decide between our alternative. In 2019, the state implements, and by 2020, the new system is up and running.
For Americans, it really comes down to cost, keeping those premiums down, those deductibles down. So how are Republicans going to be able to keep those costs down, but also provide good health insurance?
A couple ways. One thing that will help lower cost, in our bill, we include price transparency. An example. The example gives you the statistic. A woman I know, an OBGYN, a physician, she went in for a mammogram and she was going to pay cash. They said, no, we'll bill you. I'd rather pay cash. No, we'll bill you. We don't even know what it would cost you. So she says, bill me. Turns out her insurance, if she had paid cash, it would have been $90 for her mammogram. Her insurance company was billed $500 and her deductible was $100. And so she ended up paying more personally and through her insurance than if there had been price transparency. One area in which price transparency has clearly been seen to work, LASIK surgery. LASIK surgery, you can drive down the street and see a billboard advertising what the price is. And in the last 15 years, it's gone from $900 an eye, with more for astigmatism, to down to $275 an eye, because that is cash-based, price transparent.
How do you enforce that?
So in our legislation under the Republican alternative, every American gets eligible American would get an advanceable refundable tax credit, which could only be used for health care and would start off being a health savings account with a catastrophic policy. The rule in the law would say that if a provider treats someone who has one of these taxpayer-funded health savings accounts, then the provider must publish her cash price. And that way the market responds. That app is already being written. New Hampshire has such an app, so I know the technology is out there. But you would just scan and know, this is the best price. Let's put market forces into lowering healthcare cost.
Thanks so much. Really appreciate you joining us today.
Thank you, Jesse.